someone suffers from stroke every 3 seconds. We will take a 20-second video of the neck, and the risk report will be available in just 5 minutes. Currently, there is no one develop a screening tools for carotid artery stenosis.
Right. Today, I'm joined by Joy Chun from Pulxion. They're building a simple way to screen for stroke risk using just a 20-second video, turning something that normally takes weeks into something you can do in minutes. Thanks for coming, Joy.
Thank you.
Yes.
Yes, my pleasure.
Thanks a lot. So first of all, I want to know what's Pulxion and why it matters what you guys are doing. If you can.
Okay, at Pulxion, we actually develop a fast, convenient, and affordable detection tools for the risks of disease, especially for some critical life-threatening disease. So, for example, our first ever product, post-stroke, it actually target the one of the biggest silent killer, stroke.
There's a lot of diseases in this world, right?
Right.
Why did you choose strokes to go for first?
Okay, so first of all, our founder, Professor Xiao, he's a professor with National Taiwan University, and his background is very related to cardiovascular system. And secondly, we all know that a stroke is leading cause of death and disability in the world. Also, the trend is getting younger and younger, and there is someone suffers from stroke every 3 seconds.
Wow.
And it's not only impact on the patients, it's also impact on almost we can say the whole family, because of the they might decrease the income, and also there's a serious impact on the cost of care due to the disabled patient. So it is expected that by 2030 the global cost of stroke will exceed $1 trillion.
I want to know more about your background. You mentioned 25 years in pharma. That's a long time. So what's your story?
Actually, my major is pharmacy.
Okay.
Yeah.
Sense.
So that's why I started my career from pharmaceutical industry. My first job is from a very entry level as a sales rep.
All right.
And I almost run every kind of functions in the pharmaceutical companies.
Like it. And the way that you measure it, I read that is through the carotid
artery stenosis.
Yes. Why? How come?
Yeah, because carotid artery it supplies like 2/3 of the blood to the brain. So when it gets stuck, the stroke will happen. And it's one of the major risks of ischemic stroke, and which accounts for almost like 90% of all strokes. Oh. Yeah. And there are two main risk factors of stroke. One is carotid artery stenosis, and the other one is arrhythmia. Okay. Yeah, but as you might know that arrhythmia can only be detected when it happens. And the other risk factor, on the other hand, is the carotid artery stenosis, and it's more like a status. It's it's continuously, so we can detect that whenever you like, and also it in the market there are a lot of people are developing the wearable device for arrhythmia, but currently, there is no one develop a screening tools for carotid artery stenosis.
Right.
So that's why we choose this one, and there's no competition, and there's a need in the market.
Oh, that's so interesting that no one has done it. Is it because it's more difficult?
I think there are few diagnostic method in the currently in the clinical operations, but due to the cost effectiveness and the time efficiency, especially for like ultrasound, CT, and MRA, they need specialists to operate. So, for example, if we go to doctor and doctor asks us to do any of the exam, we need to arrange for another a clinic for the exam. Then we need to come back again
Got it.
to read the report. So it's like at least 1 month will pass. So it's not those diagnostic are not good. It's because in terms of the efficiency and the cost, they are not really recommended for screening purpose.
Understood. It's more
Yeah.
cumbersome than the whole process.
Yeah, yeah.
So I want to know more about this specific product you're talking
Okay,
about.
right.
What's its name and how does it work?
We name it post-stroke
Pulse.
because our first indication is really related to the stroke. And how does it work? Because our vessel is some kind like a water pipe. So when it gets stuck, the water flow, our blood flow, will be changed. So we take the video tab of our carotid artery, our carotid artery. So if there's a stenosis happen, the blood flow will change. Then it will reflect in the pulsation. So our algorithm are trained to catch those very minor irregular features of the pulsation, and which may not be visible by our eyes, but our algorithm can actually amplify the signal and catch the irregular features, then identify the risk level of the stenosis.
All right. So if someone is at risk of having a stroke, they may show something happening in their carotid, like
Yes.
maybe slower blood flow or something like that.
As the pulsation model will be different from the normal one.
And how long how long would it take to do the test?
The test, how long? We will take a 20-second video of the neck, and the risk report will be available in just 5 minutes.
Oh, wow.
Yeah, so compared to like weeks or months, then we are perfect for rapid screening.
Yes. So you mentioned that there's other ways of diagnosing the potential strokes, right? Someone
Yeah.
that is at risk. You said is it MRA?
MRA,
And
CT, and ultrasound.
all right, and they are very accurate, I assume.
The most accurate one, of course, will be MRA, and that will be the most expensive one. It costs more than 20,000.
Taiwan dollars.
Yeah, Taiwan dollars.
All right. So that's around 800 US dollars.
Yeah, 100 to thousands. Yeah. So
Okay, and so how about if we compare the accuracy of pulse stroke
yeah.
with all these other systems?
Okay, so like in our clinical studies, post-stroke has demonstrated a 91% accuracy when compared to ultrasound, which is the most the cheapest diagnostic method at the moment. So, and the result has been published in the Journal of the American Heart Association.
Okay.
Yeah, so like our accuracy will be around 90%, and also the specificity and sensitivity as well.
Oh, I see why it could be so good for us as a screening process.
Yeah.
Because it can be quick, and then if the accuracy is almost there, that okay, this person may be at risk, let's do the other test, right?
Yeah.
So that's the screening and then confirmation.
Yes,
I
exactly.
see.
Yeah.
Was it hard to develop this? Because I cannot. Maybe the AI. How did it work? How did you make it work?
I think it's not easy, we have to say, because from the very beginning, because the technology was originated from the campus. So, like, if we say from the day one, our founder, he has this idea and he started to cooperate with the National Taiwan University Hospital. It has been like 10 years from the very
Oh
beginning.
my god, yeah. That's
Yeah,
amazing.
but the company just started like around 5 years ago. But the journey was really long because like there were too many factors we need to overcome. For example, the noise from the environment. When we capture the information, we have to rule out the interference from the environment, and also like we need to make sure the light is correct, and we need to make sure the interpersonal variation, and also even the intra, like compared to the patient
Yes.
himself, the intra variation. So there are many minor factors. It seems really small, but it will eventually impact our design on hardware and software. Yeah.
All right, and going back to the screening, because I believe you want this to be a regular screening, right?
Yes. Yes.
Who should do this type of screening, or would you expect?
I think our first movement, we will cooperate with the healthcare exam centers, because in Taiwan, that's very one of the most popular channel. To do the healthcare normal checkup, it's very common, and the company, the employer are actually forced by the government. They need to provide the regular check for the employee. And in Taiwan, there are many health checkup channels. They have already had very matured package, and those package, or I think the costs are almost around like 3 to 5,000 NTD.
Yeah.
So our test can be very easily fit into the package. So make it a routine test. And also the most population who will conduct this physical test are actually the people that have the highest potential risk. For example, the people at around like age above 40s, and they
Okay.
are like workers, so they might get higher pressure. So they are potential risk population, of the carotid artery stenosis.
They may actually not show symptoms, right?
Right, right. So, like, among the people with significant CAS, like 60% of them, they show no symptoms.
Oh, that's a problem.
Yeah.
Okay.
So that's why we really need screening tools, because without symptoms, these individuals will not go to doctor, or they will not actively do any like exam, and a lot of people would just miss the golden time to prevent the urgency.
I actually like that about Taiwan, that they do focus in prevention more.
Yeah, yeah,
So you want to target or reach a lot of people,
yeah,
right? That's one of the reasons why the price can be low, because
Yeah.
you just said that it costs 20,000 for the MRA,
yeah.
but then for this one, how much would it be?
It's like the end user price will be less than thousand, so it's just couple
Very
hundred.
affordable.
Yeah, very affordable.
Oh,
Yeah.
I wonder if investors would think like, is that a problem, or how's the revenue model gonna work?
Okay. Yeah. So that's an interesting question, because since we position it as a screening tool, it has to be really easy. The quantity will be a very critical success factor for us. So how I think you might think how it can be profitable. Yeah, but first of all, I think that's the beauty of artificial algorithm and the software, because like, for example, we save around more than 90% of the time. And so that's why during this process, we improve the efficiency so that we can also largely improve the cost structure. Yeah. So for us, the margin is we get even much higher margin than the conventional diagnosis. Yeah.
And I saw that I saw something about software or hardware licensing or rent. Is it like a rent? How does that work?
we I think the hardware is actually just the media, how we do the test, we check the video, but our core value is the software. So we will charge by case. When you do a test, then we charge couple hundred. But for the machine, we will sign some leasing agreement with the healthcare channel.
Yes.
Yeah. So, but I think our main income will not come from the hardware. That is not our core business. Yeah.
Right. It's for the diagnosis and the test results.
Yeah.
Okay, that's pretty interesting. And besides, so you mentioned that that's the first disease that you want to target.
Yeah.
But I assume that there's other things coming.
Yeah, I think other disease, we can say that any disease related to pulsation will be our targets. And I think the second indication we are actively developing now is the Hava disease, because the current diagnostic method of the Hava disease are through the auscultation. Auscultation. And it's also due to the flow and the sound, irregular sound and the pulsation of the vessel.
Oh, okay. So auscultation is the type of test that you will hear to the sound of the blood.
Yeah, the valve, because when they pump differently, irregularly, people can hear the sound difference. But it really depends on the experience and the skill of the physicians. So a lot of time they may not be detected early enough to save the life, because it's one of the life-threatening disease again. So our beauty is that we can actually use the same 20-second video to run the risk level of the Hava disease, of course, by a different algorithm. We need to train them differently, because the pulsation model will be different from people with carotid artery stenosis.
So the first one is for strokes.
Yeah.
And then in the next 2 to 3 years, you will have for heart valve disease.
Yeah, I think so. Yeah.
I wonder, is that difficult to get approved by the FDA?
I think it's not really difficult, but it takes time, of course. We our strategy, of course, we will start it from Taiwan, because we are one of the kind of demo case of the CDE, our TFDA. So we will start it from Taiwan, and we expect to get the approval early next year. Then we will start it to conduct a regulatory clinical study for FDA submission next year. And I think the Clinical study will be quite different from the drug development because for the medical device, especially ours is a very low risk because it's non-invasive and no special like radiation or magnet. So for this kind of low risk medical device, the clinical study is going to be the time is going to be very short and the population will be very limited compared to the drug development, and also the result is very expectable compared to the very high risk drug development. I used to be in the pharmaceutical industry for the more than 20 years, so I understand how long process it's in the pharmaceutical, but in medical device it's like totally different stories.
All right.
Yeah.
Yeah, I think you have experience with the IPO as well, right? With,
Yeah. Yes.
So you're expecting Pulxion also to have an IPO?
I think for us, IPO it will be a plus, but it's
right.
not a must. Because in my belief, the real growth of a company should be the cash flow and the profit
Makes
it
sense.
generated from itself, and the IPO will be just some financial leverage. If we can have that, would be very nice.
Right.
Yeah.
That's very interesting because most biotech usually need that external money and not to have cash flow for many, many years. But you're saying that you like the idea of having a company that already creates its own cash flow and profits.
Because we are very confident that as long as we get the approval, we can be break even in our first year.
Wow.
So, of course, some of our investor or financial partners, they are looking forward to IPO. But I will say that it's a plus, not a must.
Communicating science has always been my passion, and I run a studio called Med Productions. Honestly, this podcast only exists because Med Productions does. We create science animations from scripting to final video to help biotech teams explain their work to the people they're trying to reach, whether that's investors, healthcare providers, or the general public. You can learn more and get in touch with us at medproductions.media. Just before we end this, there's rapid fire questions. If you had to explain pulse stroke in one sentence to a 10-year-old, what would you say?
I would say it's an amazing little box with a mini video cam inside. It can check out if your vessel is healthy.
What's the most unusual place you can imagine someone using your technology?
I cannot think one.
Anywhere?
I think it can be used anywhere.
What's one stroke prevention myth you'd love to bust once and for all?
It's not just happen to old people.
Okay.
Yeah, and it's not just happen to sick people. It's usually happen to a lot of people without symptoms. Yeah.
Which do you fear more, a bad investor pitch or karaoke night in front of your colleagues?
Of course, the pitch. Since most of my family and friends, they already knew I'm a lousy singer.
Okay, all right.
And I'm so comfortable with that.
If you could fast forward 5 years and pulse stroke is everywhere, what would be the first headline you'd love to see?
I would love to see the stroke prevalence has been decreased worldwide, and thanks to the 1 minute screening of post-stroke.
Amazing. Thanks a lot for coming, Joy. This was a very wonderful talk.
Yeah, thank you very much.